Right, so everybody has heard about PRP when it comes to the use for hair rejuvenation or facial rejuvenation. Today I want to talk about all the latest advances since PRP. A lot has happened in the past few years. So let's start with sort of the next level of what happens after that, which is PRF, plasma-rich fibrin. So this is actually a segment of the platelets that have these granules, and within them, they're able to have these cell mediators or stem cells that actually allow the growth of hair, moving the hair follicles from the sleeping phase or hibernation phase to an active growth phase. We use it a lot for scalp and hair rejuvenation. PRF, think of it as sort of being a little boost past the PRP. The next level is exosomes. So what are exosomes? Exosomes are when we take just a teaspoon of fat, we're able to get inside the cells. And the reason is because fat cells have the highest level of stem cells that we know per cubic gram of tissue. So for every cell that we have, you have a very, very high level. The problem is that you can't get inside it. So if you do liposuction and just put the fat in, you're not going to get the stem cell benefit. However, if you're able to process it and get inside, you can access it and be able to get maximal effect. Now, think about it this way. So if you have the PRP being sort of the original thing that you've heard of, the PRF gives you 3 times the amount of what's available in terms of the colony stem cell units. The next level being exosomes, you're looking at 15 times of the number of colony stem cells that are available. And the bone marrow is giving you double that amount. So you're getting more and more concentrated and more effective amounts that you can provide. Obviously, as you go up that elevator, as you go into the higher level, it becomes more of a procedure. So you do need anesthesia, you do need some sedation for the exosome usually, and for the bone marrow. For the PRF or the concentrated platinum 2.0 PRP that we do, those you do not need any sedation because essentially it's a blood draw and we're using that as a concentrated form. But think about how much effect you want to see, because based on that, we're able to provide a more concentrated form. And the advantage of that is that you don't have to do it as many times. So for example, when we do exosomes or the bone marrow, we're only doing it once a year for maintenance. Whereas when we're doing PRF, we usually have to do it 3 times, and then we have to do it once every quarter, like every 3 to 4 months, we have to do an updated form.